finding who you are, trying to get there.
Welcome to Social Work Sunday Tea. It's a great day to be alive and well. Yeah, it is Sunday, July 27th, 2025. It's a great day, great podcast day. Today we have a special guest. I know it's been a while since we've been podcasting, but we're here. We're live and in color. If you'd like to share, like, subscribe, all those things. We're on Facebook and YouTube and Twitter. So we have a special guest, Dr. Brotman. Thank you so much for coming on here.
Of course.
Yeah.
Of course. Hello, everybody.
This is a great experience, great time, great topic to talk about. So we're talking about menopause. If you would like to just give a little overview of you, like so people can get to know you, Dr.
Okay.
Yeah.
So women's health is my passion.
Yes.
I have been involved in women's health, now like 30 years or so.
Okay.
I started as a nurse on labor and delivery, then went to medical school and became an obstetrician gynecologist, and have been so lucky to be able to be serving the community and women's health for my adult life, all of it. And it's my passion. I said it before, I'll say it again. It's something that I adore doing. And I'm fortunate to be able to do it.
Yeah. So what made you get into the medical field? Like just, and say, hey, this is what I want to do. What triggered that?
So there's a feeling of the buck stops here,
okay.
right?
Okay.
So you start at the beginning and you start in an entry level position. I was a transporter, and then I became a receptionist, and then I went to nursing school, and all those things were wonderful and great and good for my stage of life.
Mm-hmm.
But you really want the buck to stop here. You want that responsibility, or I wanted that responsibility. So I knew that becoming the physician, becoming the captain of the ship was where I needed to be. And so you stop sitting back and going, I would do things another way. I would probably not have done that management strategy. And then you're it. You're the final decision maker. Everybody's looking to you, and that's what I wanted to do. And so that's what I did, and have never looked back.
Wow. And I like how you say you're like more so like you're the captain of the ship. Mm-hmm. So it's like whatever that you think and you want to do, you just do it.
Yep.
This is what needs to be done.
That's what needs to be done. That's exactly it.
Yeah.
Right. And you get to take in all sorts of facets that people may miss, socioeconomic, cultural. It's not just about medicine, it's about treating people. Absolutely. Right. It's actually not about medicine. That's actually not the hard part of my job. The hard part of my job is to be able to stay attuned to the women that come through my door and be able to satisfy and come to terms and understand what they're telling me and addressing their needs. And so that's been the joy of what I do.
Absolutely. And thank you for doing that, because a lot of people, oh, this is what I want to do, but you have passion behind it, and I feel that. I feel that energy, like you're for people, and really just kind of like getting people to know things about their health, the overall well-being, you know. So I think that that's amazing. And so what brings you on the show? Like, we're gonna talk about this thing called menopause.
We're gonna talk about this thing called menopause, and we're gonna maybe take a process that is unfamiliar to people, even people who are going through it, and break it down so it's not scary. So it has a definition, because once you tackle it, then it becomes there's less fear around it. Right. Definitely. And it's a beautiful stage of life that those of us that are lucky to be able to develop into have to understand that, you know, the options of not going through menopause are terrible. So this is great. This is a great way to be able to mature and grow and be set an example for the rest of your community.
Absolutely. So let's start with the basics. Explain the difference between, because I mean, I'm still young, so I'm just still like, I don't know, like like I was telling you before, my body going through some changes, and I'm really trying to figure some stuff out. And so can you give us an overview, like explain the difference between premenopause, am I saying it right?
You're saying it right.
Perimenopause, and then menopause. I know that, you know, it's everybody say, oh, it's a difference. And I'm just like, menopause is menopause. That's how, but if you can just give us a clear overview of explain the difference between those terms.
So it's a spectrum.
Okay.
Right. And so we all go through at various stages of our life. Our reproductive stage of our life, we're in adolescence, and then we go into reproductive, which is when we're able to have babies. And then as we mature a little bit past that stage of life, and age is not always necessarily a predictor of, it helps, but it's not a predictor of entering perimenopause or menopause. So premenopause is before any of it happens, right? So that's your reproductive phase. Perimenopause is the period of time where before or just after you've hit menopause, and I'll give you that definition in a minute.
Okay.
Where your body starts to make some changes, and there are those of us that are very attuned to all sorts of changes that, you know, that you'd be surprised that some people tell me they're like, I'm just not feeling right, and all of a sudden you discover they have a gallbladder issue, right? So I love taking care of women because they tend to be very attuned. We have to be, right? From that first moment that you discover that there's a potential that you may be pregnant, you got to pay attention. You simply have to pay attention, because what you do affects that pregnancy. So that's just a beautiful part of taking care of women. The definition of menopause is not having a cycle for 6 months or more.
Okay.
So once that happens, you have entered menopause. Does that mean, that doesn't necessarily mean that you have all the signs and symptoms that your sister may have of menopause. Sometimes women have what they call hot flashes, or just, you know, burning up. And women very typically describe this as like, my head's on fire. Things are just, you're on fire, and you were sitting comfortably. You were like in thermocline, and then all of a sudden you're no longer in thermocline. There's like you wake up in a cold sweat, or that's one of the main symptoms of entering that phase of your life.
Yeah.
The other thing that's really affects us is a brain fog. A lot of women will complain of, you know, I stopped having a period, and all of a sudden I can't think clearly anymore. So that will boil back down to either having hot flashes that you're aware of, or that you're not aware of, but they wake you at night, they stop your sleep, and that affects your clarity. Right. And so it doesn't matter how many cups of coffee that you have. It doesn't matter what you do. If you lack sleep, and you're not trained like a pilot or a surgeon or whatever to be able to tolerate that little bit of sleep, or that interruption in your sleep, and you're not used to it, that's what's going to happen. And so that mind clarity goes away. And so hot flashes, mind clarity. There's a couple other symptoms like vulvovaginal dryness, and your skin will have some changes. So those are things that will happen the definition is 6 months without a cycle. And then of course, stopping your period. That is the flag that you've gone through menopause.
Yeah.
Like I know people who are like, my only symptom was that I stopped my period, right?
Mhm.
And then other people are like, I feel like I've gone through menopause and I'm still having a cycle every month. And so that is, there's all sorts of different variations on a spectrum. And
Yeah.
those are things that women tend to be very attuned to. And the more knowledge they have about it, the better able they can, if they have symptoms, they can treat those symptoms or relieve themselves of those symptoms. So the knowledge of it is power, right? It's nothing to be afraid of. It's something to embrace because we're going into this, and thank God we're going into it.
Yeah, definitely. I think more so how you touched on the early, well, as far as like the symptoms, the early signs and symptoms, like with the brain fog, with the hot fat flashes. Like a lot of women that I know, they like, whoa, like they just like start stripping away, and I'm just like, whoa, okay. Like it's just like it's on 1,000. Like it is a lot.
It's very uncomfortable.
Yeah,
it sounds like something that's very benign. It's very uncomfortable. It's very uncomfortable to be standing there in a meeting or talking to people, and all of a sudden you can feel your face flush, and you can't focus on anything else. You can only focus on trying to get out of whatever situation you're standing in so you can bring yourself some comfort. So I get it. It's very uncomfortable.
Yeah. So like with the perimenopause, that's the kind of like
time around it.
Okay.
So you may still be having a cycle, but then you start to have some of these symptoms and you're like, well, that simply seems unfair, right? Yeah. I'm still having my cycle, and now I'm having symptoms that show that I'm heading towards menopause. So that's kind of like the worst of both ends, but whatever. There's things that we can do to help alleviate the symptoms that make it uncomfortable, and get you past that point, so that you optimize your life, right? It's not just being healthy. It's about being the best you.
Yeah.
So putting forth the best you is what we try to make sure. It's not what I do. It's what I try to make sure that I can satisfy with all of my, the clients, the patients that come to see me. That's what I'm trying to do for them.
Yeah. So what are some lifestyle changes, like I guess diets, when it comes to like women that can make, like in their 30s and 40s, like for that transition of perimenopause, such as myself? I'll be 40 this year, and I'm just like, oh no,
it's coming. It's good.
Yeah. So like what are some tips you can give in that age range, and then we can go further into like women that are 50s and 60s and things like that, like as far as changes.
So what really boils down to is something that we all know is good nutrition, and a good BMI. It doesn't have to be your body type. Shakia is going to be different than mine, and where I'm comfortable at my BMI, you'd be like, girl, I can't be there, right? But it's where your body is at the proper weight that it should be, so that your organs function at their best, and you feel like you're at your best. That's where it starts, right? Good dentition, good dental care, making sure that your cardiovascular system is up to par. Exercise is so important. It can be something that is a lifesaver, and it doesn't have to be, dripping sweat. Sorry, Orange Theory. I don't mean to be promoting anything, but that's the only thing that comes to my head, which is dripping sweat, 1 hour of work where I'm exhausted and I need a nap afterwards. That's, it could be yoga. It could be a brisk walk. Walking is some of the best exercise that you can do. And it's important to be able to get those characteristics, those habits in your 20s and your 30s, so that when your body starts to go through changes, and the changes could be pregnancy, Shakia. you know, that's a big change on our bodies. You're growing another human being. And so the healthier you can get before you get pregnant, the better off your pregnancy is going to be. Same thing with going through a change of life. So good nutrition, good exercise, keeping your body weight at its optimal. It doesn't mean, you know, having 1,000 calories a day. That's not the answer. It has to be something that you can sustain. Alcohol is a big deal. Smoking is the biggest deal. I remember people telling me that the biggest predictor of somebody to quit smoking is if their doctor tells them to. And I always thought, really? People don't know it's unhealthy to smoke, right? And you need to wait until your healthcare provider tells you to stop smoking, but it's true.
Yeah.
It's really true. So it's something that, you know, I have medical students with me all the time and they're like, they look at me and they're like, really, you think that this pack a day smoker who's chain smoking is going to stop because you tell her to? That's really true.
Yeah.
That's the power of caring about somebody and putting forth everything that I know how to do to make sure that you're at your optimal health. So those are things that you can do when you're in your 20s and 30s. As you start to go through your 40s, keeping those habits, right? Because that's when things like cardiovascular disease and lung disease starts to not really take hold, but they start to make their effects known at that time. So if you're a smoker, you probably tolerated your cigarettes in your 20s and 30s very easily. Then you start in your 40s, if you're still smoking at the same rate that you were when you were younger, that's when it really starts to affect you. And those are habits that you can absolutely have control over. So, you know, having a little bit of good decision making, making good choices is what's important as we go into our 40s. Recognizing what's happening as you get older. Sorry, I'll just keep going until you stop me, Shakia. So
no, go ahead. No. I'm reading the comments. No, I'm reading the comments. They have questions.
Okay.
No, go ahead. No. Finish your statement, and I'll
get to as you go into your 50s. That's what's really important. Late 40s, early 50s. Average age of menopause in our country is 51, maybe a little bit earlier, and it's different for the African American woman. She'll go into menopause a little bit sooner. And it's a body type. There's no good reason, but culturally, Asian women tend to have more osteoporosis. Hispanic women tend to have more diabetes. Alaskan women tend to be more susceptible to alcoholism. So all of us white women have osteoporosis. Black women don't have that. So knowing that cultural change is super important so that I can address what's important in your culture. That's one of the things I love about what I do is that I'm not just treating a 40-year-old, I'm treating a 40-year-old with all of her cultural and socioeconomic background and making sure that she can put her best foot forward. As you go into your 50s, noticing the change is important so that you can make sure that nutritionally you're up to speed. Things like tea, menopause tea, those are really important, right? Absolutely, because it keeps you grounded, right? So where you might want to grab that glass of wine or the third glass of wine, that cup of tea is going to keep you clear-headed, let you sleep better and wake up more refreshed, right? And so it's a much better idea, right? And it's something that we have to think through.
Absolutely.
You know, I could go on in your 60s and 70s, but let me stop there and let's time for questions.
Okay, they said, okay, and what about the people who don't even have a PCP? Who are they still navigate? Who are still navigating life, carrying trauma or historical events that shape their thought and behavior about health overall?
Those are the people that when I get in contact with them, I love to interact because I get to change your mind.
Yeah.
You may see me as this pillar of a system that you don't like, healthcare system, but I want to be approachable. I want to be somebody that you can come to with all of your problems, whether they're menopause, gynecologic, pregnancy related, or something that you may think is unrelated. So kind of getting through that barrier, Shakia, and finding a provider is the first step.
Right.
And developing that trust with that provider, that's the most important step. right? So I often have students rotating with me, and we step out of a room and they'll say, "How did you pick up on that?" And I'm like, "I just did." Right?
Yeah.
There was just something that she mentioned, and that's the road that we went down because it wasn't the traditional route. And we just found out what the crux of the problem is, and that's where we'll go from there. And you may get all your questions answered in one visit. I doubt it. Most of us are much more complex than that, but it takes that trust in that relationship to be able to move forward.
Absolutely. Absolutely. I think that's the best thing, because I know in the African American community, we're not too trusting of the healthcare system because of what's been, done to us, especially
Historically,
yes.
African American women have a horrible track record with the healthcare system.
Yes.
We have failed them.
Yeah.
We have simply failed them. We are to be able to reach a population that has previously not had access to care is so important, Shakia. And the healthcare system as a whole has failed certain factions of it.
Yeah.
They've just failed them, right? And so, as a solo provider or a provider that could be employed, it doesn't matter. You have to put yourself out there. I have skills that I can offer people, and I'm privileged to be able to do so.
Yeah. So I'm looking, because I don't know why it's not pulling up on my screen, on the other screen, but I got the other phone and it's pulled up. Patrice said, I hate night sweats. and Denise said, everyone, it's the hello everyone, it's the mood swings for me.
Mm-hmm.
Yeah, like it's really, really bad. Some people have it more severe than others.
Mm-hmm. So mood swings, night sweats.
Yes.
A lot of that has to do with a decrease in estrogen.
Okay.
That's what happens. Your estrogen starts to go down. So your ovaries they produce a lot of hormones, but estrogen is one of the major ones. As we have a finite number of eggs or follicles inside our ovaries, once those run out, by the way, that doesn't mean you're getting older. It just means you're moving through a different period of your life. We have the most number of follicles or eggs when we are in utero, when we are infants and babies. And then once we're born, that starts to decrease dramatically. And then every month we have a cycle and we decrease the number of follicles that we have. So as those follicles go down, our estrogen level goes down.
Right.
Estrogen is really important to control our thermoregulation, right? Those hot flashes. And so that flashing, if it wakes you at night, your mood is in the toilet, right? Because if you can't get a good night's rest, if you're sleeping 4 hours or 5 hours and your sleep gets interrupted, even if that little bit, and you get to lie down, we're all really busy and we're all multitasking. So you get to lie down, but you don't get that 8-hour stretch or however long that you need. Your mood is in the toilet. Your mood, you can't cope with anything or cope with the anything that's given at you the way you want to do it, with the grace and motility that we all want to strive for. So those hot flashes and waking up at night, that is absolutely a result of your mood, right? And so if your moody, you find yourself moodiness, you need to find something to help you sleep and sleep all night long.
Yeah.
And if you have a hard time with that, naps during the day, right?
Yeah.
It doesn't have to be a long nap. A 20-minute nap can certainly refresh us, bring us back to ground zero, so to speak, and help us cope with things.
Yeah, definitely. Someone asked, are there any hormone therapies that you'll recommend for menopause, perimenopause?
So estrogen is the big player.
Okay.
Estrogen is absolutely the big player. Estrogen can come from actual estrogen pills or estrogen creams or a patch. It also has precursors like soy and isoflavones. And the problem with getting those is that they're not regulated.
Okay.
So you may find an herbal substance or a dietary supplement that has a precursor to estrogen, which will convert in your body. But if you can't control, you don't know how much you're taking, it's hard to control it.
Okay.
Right. So if you're going through a period of time where you feel like you need some medicinal support, estrogen's your answer.
Okay.
Right. And it doesn't come without its risk, which is why having it in a non-regulated form is actually really deleterious to us. Right. And so having something that we can control, and it used to be that we would give estrogen pills from when you hit near menopause till death. We don't do that anymore. Now we listen to people.
Yeah.
And decide how long they need the treatment for, and less is more. Right.
Yeah.
It could be not every day of the week. It could be 3 days a week that you're using some estrogen. Right. But wouldn't that be a lovely thing to be able to start a pill once a week or twice a week and relieve you of all of your symptoms so that you can sleep and become and go back to the person that you trust being? It's an easy answer. And a lot of us shy away from medicine. I do too. I don't want to take pills. But if that's what's going to help me at this point, I'm in.
Okay. Okay. Someone says, I just realized that I've been experiencing brain fog. I almost ignore it, but didn't think it was related to menopause at all. Yeah.
So
Yeah.
that moodiness, that lack of sleep absolutely causes that brain fog.
Mhm.
And people just chalk it up to getting older.
Mhm.
No, I mean, it's a different phase of your life, and so you have to treat it differently. The brain fog that we had when our kids were little, because there was so much going on, this is kind of the same thing, but a little bit different in line, right? You're like bleary-eyed because you have a new baby in your house,
Yeah.
and that baby doesn't sleep at night, and you get up in the morning, you're like, where was the thing I was walking in the kitchen for? That's the same thing.
Yeah.
Right. And as we get older, we don't cope with that lack of sleep any better. So thinking clearly is super important in making sure that we are our best selves.
Absolutely. Absolutely. Yeah. Those are good questions, everybody. Just keep them coming. The doctor is in, but no, like that, people were saying that healthcare starts at home. Like, when it comes down to management, as far as like getting yourself together. Oh, thank you for saying that out loud. Okay. All right. They coming in. Yeah. All right. Yeah.
Oh,
So
now I can see them.
yeah. Oh, you can. Okay. Okay. Cool. Yeah. 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 They definitely coming in. Well, when it comes down to like the brain fog, like difficulty concentrating, short-term memory, also I want to say it from a clinical standpoint, like it's kind of like it gives you a higher risk of like development on like onset of depression, like like even if it's prior history of depression. But I just think that like any recent trauma, any recent grief, high stress environments, that's kind of like that's that perimenopause, like with women in that in that arena. I just think that we need to be cognitive of that as well, as far as with the anxiety and the stress.
And wouldn't it be nice to be able to pinpoint something that your psychiatrist didn't think of, or your therapist didn't think of,
Yeah.
or your primary care doctor didn't think of? So
Yeah.
somebody who encounters women all the time, that's who really needs to treat us.
Yeah.
My background is not in primary care. I treat pregnant women. I operate in an OR, and I treat women completely, right? And so you may walk in my door, and that may be, we're not talking about your heavy bleeding or something along those lines, but that's not the first and foremost issue that you're having. And can your depression be a part of that brain fog? Absolutely, right? It's isolating.
Mm-hmm.
You can't get a full thought out. And so all of a sudden you start to back away from your friends and your family and your support system because you don't feel like you can communicate with people anymore. That's really challenging, and it's a real thing. It's something that should not be written off.
Uh, someone say, I find that using marijuana in the flower form is the only one thing that I can say for certain relieves me of all of my perimenopause woes. So
not studied. I'm not going to refute it, right? And up until recently, not a legal way to treat it. But if that's what seems to be working for you and it's not causing deleterious issues in the other parts of your life, have at it. Absolutely have at it. It's something that you have access to, and it can make you more comfortable. And again, put your best foot forward. If that's what's working, that's okay.
Yeah.
There's no judgment involved. That's okay. It's not studied, but it doesn't mean it doesn't work.
Yeah. How important is magnesium for women? Someone asks.
Magnesium is super important to help you sleep.
Okay.
Right? It's a body, it's an immune system support, and it helps you sleep. And so sleep is also super important to help support your immune system. And magnesium helps us get there.
Absolutely. Absolutely. Yeah.
Careful, watch super doses of magnesium. They're not good for you. Super doses of any vitamin is not good for you. Most of them just get eliminated from our body, but also not good for you because they're expensive and you're taking pills, and less is always more, right? And so a little bit of something is good. It doesn't mean that more of something is even better. But magnesium is a super important element that we have to make sure that we get at least in our diets.
Okay. Cool. I think more so, kind of like when it comes to as far as like with anxiety and depression, right? Even with self-esteem, right? I think, feeling loss of control, shame, invisibility, like negative self body shame, right? Because when you're going through this changes, it plays on the mental and your emotional regulation. It's off, so it's like, I don't feel the same, I don't look the same. I
can't project the same.
Absolutely.
I can't affect my friends and my community the same way that I did before. What's wrong with me? There's nothing wrong with you. You just might need a little bit of tweaking to get you to where you are comfortable in your own skin.
Yeah.
Right? But anxiety and depression can get tipped off by almost anything.
Yeah.
And it could be the littlest of things, and then all of a sudden it cascades down and you're nowhere near where you want to be. You feel out of body.
Yeah.
That's that out of body that's really uncomfortable for people.
Yeah. And body dysmorphia. That's that is huge. Even if it's not related to menopause, I think just in general, and identifying ourselves, like how it impact our self-esteem, when it comes down in identity, so it's just like, going through these changes, like you said, like I don't feel the same, I don't look the same, I don't even feel like I'm like, this is natural, so
right. I don't feel like it's me.
Yeah. So how do we, and I know that we kind of like, how do we get there? I know with therapy, I use cognitive behavior therapy, kind of like what affects our world functioning. And menopause, it affects us. Yes.
It's going to sound silly, writing down the symptoms. That's the first thing.
That's not silly, Doc.
It's just document it so that Monday, this is what I felt. Tuesday, this is what I felt. Not just for yourself to review, but when you go to somebody like you, Shakia, or somebody like me, you walk in with a piece of paper and be like, this is what I felt last week.
Yeah.
Right. And hopefully that person that you're showing it to will sit down for 10 seconds and read it and get some sense of what you're going through. So writing it down, I think, is super important, or documenting it in some way. You have a phone, you're recording it in your phing, whatever it is. It's just a concrete way to be able to describe what you're going through. I think that is the very first thing that you should do. And then start to reach out. You have a community around you. Women tend to be very good. We're very chatty, right? And that's a great source of support and pulling in support from people around you,
Absolutely.
right? I love to be able to, they'll often say that preemie girls will do better than preemie boys because they're chattier, their lungs develop faster, right?
Yeah.
So if that's the only thing you take away from here, that is a positive attitude to be able to say that I can talk to my girlfriend or I can talk to my therapist and describe my feelings. That's what's going to address them.
Yeah.
And trust your provider.
Yeah.
You have to trust your provider. They're there to do a good job. They may not have the skills. At some point, some things come across my door and I'm like, not sure how to take care of that, but I know somebody who does.
Yeah.
I am find you the right resource.
Yeah. Yeah.
So,
And that's the beauty of it too. You know, just active listening to, like, this is what's going on, especially if we're doing the symptoms tracking, like, hey, this is what I got.
this is what I have. It's right here.
Yeah. Yeah, definitely.
It's right here. I didn't make it up. I didn't perceive it wrong. I wrote it down when it happened. And this is what it is. And please help me.
Yeah, definitely. Someone asked, can you touch on menopause and fibroids?
And what?
Fibroids.
Fibroids is a whole nother discussion, but I will try to address it in a bullet. Okay.
Okay.
Fibroids are tumors that are benign, not cancerous, found in the uterus, more likely in certain cultures and populations. Fibroids in and of themselves are not dangerous. If they don't bother you, do not bother them. The good thing about menopause is that fibroids get bigger under estrogen. So as your estrogen goes down, your fibroids should stop growing at the rate that they were. That doesn't mean that your fibroids don't need to come out. They may still need to come out. They may still need to be addressed. Doesn't mean that it's a huge surgery. What it means is that they need to be addressed. They need to be followed. And again, if they're not bothering you, don't bother them, right? If they're at a certain level that it's not affecting your health, just because you have them does not mean that they have to come out. Does that mean that some fibroids have to come out? Absolutely. My living is based off of it, right? Taking care of women and their fibroids. But menopause should help decrease, because of a decrease in estrogen, the rate of growth of a fibroid.
I hope that answered the question. that was good information. Like, I didn't even know that. Like, who would have thought? Like, I didn't know. So I want to ask you, what are the most common myths or misconceptions when you hear about menopause?
That your life is over. That is the most, like, you will stop being productive. That is the key. You will stop being a productive member of society. And we all have value. We all have value to show another generation, older or younger. And so menopause is just another phase of your life. It's like pregnancy, like adolescence, like whatever's there. This is something that we get to experience it gracefully and pass on that experience.
Yeah.
So that's the biggest concern that people do. Like, I'm old now. I've been through menopause. No, I'm just entering my next phase of life, my next career, my next adventure.
Yeah, definitely. I want to ask, okay, I got a question with that. Okay, when you're in those stages of pre-menopause, perimenopause, and what about the women that get pregnant in between that?
So that happens.
Like, when I was like, oh, I'm going through menopause, and then all of a sudden,
because I feel like I'm safe and I can have intercourse without protection, but there's that one follicle that still remains, and that happened right when you had intercourse, or that follicle was exposed to sperm, and then all of a sudden, isn't that the nice clinical way of saying it?
Yeah.
That you had sex, and this is what happened, and those pregnancies can be easy and successful. They tend to have more issues the older we get.
Okay.
That's just the answer of pregnancy. Does that mean that you can't terminate a pregnancy? You can. It's a healthy way of doing it. I'm sorry if it's not politically correct, but it is an option still as a woman to be able to do that thing and have control over our bodies. I wholeheartedly believe in that. So the pregnancies do occur. You still have to use birth control until you can document that there are no more follicles, which you can't really do. Women in their late 40s and early 50s have gotten pregnant. I've delivered them, right? And so if you want to be 100% certain, you need a form of birth control, a condom, a pill, an IUD, something that's effective.
Yeah, because like, so
because if you don't want a baby now is not the time to have it.
Yeah, I'm done. I'm done, doctor. I can't. Like, no. Okay. So I got another question. Can a woman experience menopause after age 60?
Mm-hmm.
Or is she now safe and have escaped it?
Oh, symptoms. We're talking about symptoms of menopause. She went through menopause, but she didn't have symptoms of it.
No. Like, can you experience menopause after the age of 60?
You can.
Okay.
But I mean, some women will have their periods up until they turn 60 or in their 60s. Something they need to make sure that they get monitored. Because the older we get, vaginal bleeding is something that is a sign of something dangerous happening, right?
Okay.
If somebody's bleeding in their late 50s, and it's abnormal bleeding, or late 40s, please get it evaluated. That's very important to do. Can women go through menopause at 60 or above? They probably went through some form of menopause before that. They just didn't notice it. Because they didn't have symptoms, because they kind of sailed through it and everybody else around them was complaining of hot flashes, vaginal dryness, brain fog, and they didn't have it. And then all of a sudden they have it in their 60s. Make sure it gets evaluated to know that it is a normal process, a physiologic process.
Okay. I didn't know that either. We're learning something new, everybody. Because I'm like, doctor, please help me. Because like, even at night, I'm gonna talk for me. Like, at nighttime, I break out in sweats out of nowhere. It is like the most horrible thing ever. Like, I just feel like I'm in the oven, and then it turns off. Then I put one leg out the bed, the other leg.
And you're freezing.
Yeah, like, I don't know. Yeah, I just don't know.
A little bit of estrogen will help that. Just a little bit, just a touch.
Okay, a little taint of it. Okay.
Just a little bit of estrogen, like normal estrogen, estrase, estradiol, something like that. Something that's in a pill form or a cream, but a controlled substance, not like an herbal thing or a dietary supplement. That's not what we're looking for. We're looking for a little bit of medicine just to help you through that period of time. And it's just a little hump till your body gets used to it.
Oh, the only symptoms I had was night sweats. Okay.
Yep.
Okay. Yeah, that's
so it happens, and your sister could have something completely different.
Yeah.
There's no recipe.
Oh, wow. Is having a delayed cycle for 3/4 consecutive months indicate perimenopause, or is it?
Say that again. Is having a delayed cycle for 3 to 4 months?
Yes.
Not necessarily. It depends on your age.
Like 40.
Could be. It could be something that we start looking at and monitor, but time is always going to tell you that answer.
Okay.
Right? If you delay your cycle for 3 to 4 months and then all of a sudden you start having cycles again, probably not yet menopause. Make sure it gets monitored.
Okay.
An evaluation. There's things that could happen, like worst thing, cancer, and we need to follow it. We need to find it as soon as possible. Endometrial cancer is real, and it's something that we can find and treat early. And the earliest sign is abnormal bleeding, right? So that kind of offhanded remark as I have my hand on the door and I'm walking out, and the patient says to me, oh, and I didn't bring up the fact that I stopped having my period for 3 to 4 months and now I'm bleeding again. Then I take my hand off the doorknob and I sit back down and we deal with the issue that's at hand, because it's an important one.
Yeah. She's 41.
Okay. So 41 and a delayed cycle is probably not the worst thing in the world. It just means that your ovary did not fire a follicle or an egg at that time, right? If your cycles go back to normal, then you're like maybe around menopause, but probably you have some time left. If you see that it starts to happen more and more often and it should taper off, like your bleeding will taper off, then you're going near menopause.
I don't know if I'm coming or going, doctor. I'm just like, whoa, my mom, she's on here. Hey, mom, like she goes, like she was like, oh, it's so hot, and she got the fan. Like I just the women that are around it, and then all of a sudden, oh, I'm cold, and I'm just like, I don't like.
Remember, I told you, I'm holding on my fingers, little bit of estrogen. Yeah. We can start and see if your symptoms start to go away, and it's not for everybody, but it has to be monitored, right? The reason that we don't give estrogen as a blanket, like we did when I was in training 20 years ago, now almost 30 years ago, is because estrogen can have bad effects. It has some bad side effects and has some deleterious effects, right? Things like blood clots, cardiovascular disease, and really breast cancer is not one of them, but it is a myth that taking estrogen will cause breast cancer. That is not true. Things like colon cancer, all those things can be helped with a little bit of estrogen, but it's very specific to each person, right? There's no right answer for everybody that I can sit in a podcast and say, everybody needs this thing. It's a miracle. Right. It is not.
Right.
You have to deal with the whole person, and it can help. If you have a family of people that feel like they're burning up, then we need to talk to your sister. We need to talk to your auntie. We need to talk to those people so that we can figure out what's happening, because it could be a different thing for each person, right? It's not necessarily the same thing.
Wow. That's good, Doc. Like, all this is good. I hope it's helping everybody. I know it's helping me, because I'm like,
good.
But no, like, this is a great discussion, and I just really love how everybody's asking questions. I'm looking at two phones, the screen.
No, I see you. You're done.
Yes,
this is good.
Yeah, very much so. Like, this is really good, and I hope that everybody is like taking notes. Just really monitor your symptoms. Get a notebook. Your daily, what's going on with your body. So when you do go to the doctor, you can be like, hey, on this day, on July 27th, I had this. But July 16th, I was feeling this. I'm glad that you said that, Doc, because I think every woman, we should document the changes that we're going through, especially in this age and this climate, especially going into pre-menopause, perimenopause, and then menopause. Like, I just think documenting, period, even even if we have teenagers on here, like, document your body. What is your body doing? Because our body tells us a lot of things, and majority of the time I ignore it, Doc. I'd be like, I'm okay, I drink some water, I'm good, right?
But that's always our answer, right? And we kind of just push through because we have so many people depending on us. Yep. Teens, if you're on here, find yourself a doctor, find yourself a gynecologist. If I can reach any single teenager and tell them to find another provider other than their parents, their mom or dad, to be able to guide them through this, we are that person. We are the person to be able to guide you through where your girlfriends cannot. Yeah. Because they're at the same stage in life as you, and so they have no more experience than you do. So find that person who can talk to you about things like STDs and early pregnancy and pregnancy loss and things that you may not be comfortable talking to your mom about. I'm that person. Find somebody like me.
Yeah. Thank you, doctor. We appreciate this. Is great advice, like great information. Like, you definitely schooling us on
sharing. I'm sharing. Sharing what I have, right?
Yes. Yes, and we love it. So I want to just say, like, what if anybody got any more questions, just drop it in the chat real quick, because we're gonna wrap it up soon. I don't want to hold the doctor long, but I just really think that it's so imperative that we talk about these things, because people are going through it, and people think that they're by themselves, or, and it's really not like that. Everybody is going through, as far as women, we're going through the changes, and I think that having this open discussion, this dialogue about menopause and the different changes in the brain fog, and then the depression or anxiety that come along with that, the short-term memory loss, you got difficulty concentrating, you have like the slow pace, like processing things, things like that. And it affects our cognitive functioning from a clinical standpoint. So I just think that the things that we experience, it all goes hand in hand with our mental and our physical health.
And remember, you have to remember that we are privileged to be women because we go through all these phases of life for a reason. We go through adolescence, we go through our reproductive ages where we can have babies, we get older, and we go through menopause. And that's women's health and men's health are completely different, right? And men don't go through changes like that. They will go through a steady change, but they don't go through this. Today I had a period and next month I didn't have one. That kind of magic doesn't occur in a male. It just doesn't, right? And so finding somebody that you trust that can be able to address it, and it doesn't have to be a woman. It could be a man. That there are male doctors who you can trust and who you can describe these things, and they have seen them and heard them enough that they didn't have to experience them themselves. They can guide you, right? But what I found is, as I get older in my profession, when I was a young doctor, a baby doctor, then I had a lot of young patients. And as I get older, I get the breadth of patients, right? I get people who are not, somebody going through menopause doesn't want to see a 25-year-old as their provider. I don't. I want somebody with a little bit of experience to be able to address my needs. And that's what you start to get. And that's a good thing.
Yeah. And I'm with you on that, Doc. Because if somebody is 25, I'll be like, now, wait a minute.
Right. They haven't been through the things yet. They have a little time to learn. Right. And had you told that to my 25-year-old self, I'd be offended. But I do have the years I have the time. Right. I've lived it. So I get it.
Yeah. And we thank you. We thank you. Patrice, you said magic. What magic? Oh, like okay. But I just think that as women, we have this superpower. We're very resilient, especially us going through all those stages. And men, they don't understand. They never understand. And so it's like, them, if they get a cold or they get sick, they feel like they're going into cardiac arrest and call the paramedics, please. Like they think that the world is over, and we have babies, we go through these changes, and we still persevere through it all. So
get up and go to work the next day,
like it's nothing. And I just think that we as women need to extend ourselves some grace and really pat ourselves on the back for the extraordinary things that we do, even though we don't. She said, I meant we have that magic. We do have that magic. We do. We definitely do have that magic and that superpower that that we can do anything, so
change the world. That's the answer.
Yes. Doc, without us, the world wouldn't go around,
Right.
Wouldn't go around. So I want to ask you your final thoughts. Like, what are words of encouragement, some wisdom that you will give women that's feeling overwhelmed, misunderstood, unsupported during this transition?
So the biggest leap that we have to make is to find somebody to trust, a provider that you trust, to be able to address your concerns. You may think that your concerns are little in my day. They are not. They are something that I will listen to, or the provider that you find and trust will be able to listen to and address, because we've seen it before. We've been there, either seen it personally or seen it before in our professional lives. So find that provider, take that leap, and then stick with that person. And that could be a therapist, that could be a gynecologist, it doesn't matter. It's somebody that you can trust, that you can be able to tell them what you're going through. And if that person can't help you, they will connect you with somebody that you can.
Yeah.
That's the most important thing, right? If you can get access to care, the care will happen.
Yeah, definitely. I got a question. Wait, one more question before we leave. Okay. How can men help the women with symptoms?
Listen. Just close your mouth and listen to what I'm saying.
Yeah.
Right? They all have the ability to troubleshoot just like we do. Right? They have the ability to troubleshoot. If something's broken, they can fix it. I'm not broken, but I may need some help getting out of this.
Yeah.
Right?
Yeah.
This is what I'm feeling right now. If you could just pay attention and listen, pay attention. That's the most important thing. Right?
Yeah,
And if your partners can do that, and the men around you, my kids, I have 2 sons, and they pay attention.
Yeah.
Right. And they may have the ability when they were babies, they didn't, but now that they're older, they have the ability to listen to me and to not focus just on themselves like kids do.
Yeah.
It's helpful. It's really helpful.
Yeah. Yeah.
Right. And so if the men around you, if they could just pay attention and try to listen, it may not be an issue they can solve, but feeling heard and that validation
Yeah.
is like step number 1.
Yeah.
That's why finding a provider that you can trust, step number 1.
Yeah, definitely.
You're not by yourself.
Yeah, absolutely. And since we're talking about menopause, I created a tea just for women. Right? It's called Pause for menopause.
I love it.
Yeah, me and Dr. Brotman, we're gonna have it rocking and rolling when it comes down to menopause, and as far as with women health and wellness. I took the necessary steps to correlate and create this blend just for women. Yeah. So yeah, it's on my website. I gotta give the good doctor some, and we're gonna rock out. It's gonna be a movement, it's to help women, empower women as far as when it comes down to the transition and helping, as far as with their overall, mental and physical health. So yeah, it has sage, red clovers, lemon balm, ashwagandha,
nice
straw, licorice root, and rose petals.
Nice.
So yeah, perfect blend, I believe.
Getting a good balance. Getting a good balance is super important. And absolutely. Empowering women, I wish you'd have said it louder. Empowering women, that's what we need to do.
Yes. So yeah, hit me up if you need this. And so it's just kind of like I just wanted to incorporate women's health, because I think that we as women, right, we forget about ourselves because we're taking care of everybody else. And hey, what about me? So I'm thinking about you, and I'm thinking about me as well. As I go through these transition with the night sweats, and I'm cold and I'm hot, just going through those different going through the transition. And so yeah, it's available. We got the tea.
Awesome. Awesome.
Yes. So thank you, doctor, for coming on the live.
Thank you, Shakia.
Amazing time. Great schooling us and giving us information. I hope everybody took away, something away from there, from this podcast and this discussion. And you can share with other people. You can share this live podcast to all of your loved ones, your aunts, your nieces, your daughters, things like that, because it's necessary. And so they're given the tools they need. Like the playbook, so when their time comes and they go through the transition as a woman, then they'll know like the do's and don'ts and things that they can do as far as to help themselves.
Absolutely.
Yeah. Thank you so much, doctor.
My pleasure. My pleasure. What a great tool and platform to be able to reach your audience.
Yes. How can people find you? Because they like, where's she at? Where can people find you?
I have a Google site, and so you can find me through there. My email is the easiest way, Monique Brotman, first and last name @gmail. That is the easiest way to find me.
Cool. Thank you so much, doctor. I
Thank
really
you.
appreciate it. Until next time, everybody, you guys take care of yourself, and I will see you on the next podcast.